You can see this line.
For those anxious to know whether they're infected with the coronavirus, the wait to be tested can be excruciating.
Pretty far.
The same goes for waiting for test results.
Sam on my team got tested, and Sam, what was it, 10 days, 11 days, 14 days, right? I mean that's ridiculous.
Experts say the disease has spread faster than what labs can handle. Researchers at the University of Colorado Boulder think they've come up with one answer: a rapid, portable, saliva-based COVID-19 test. No need for nasal swabs or fancy lab equipment, just spit in a tube.
And the results can easily be read by eye because our test changes colors from pink to yellow if you're positive for SARS-2.
Much like a pregnancy test. It's based on a technology called reverse transcription loop-mediated isothermal amplification, or RT-LAMP, previously used to screen mosquitoes for the Zika virus. Samples are heated and added to mixtures which undergo a chemical reaction when the genetic material from the SARS virus is detected.
They can set this up on a table in a parking lot as long as they have power and test people.
CU Boulder's Roy Parker says the test is geared towards detecting asymptomatic people who make up as many as 70% of coronavirus cases. Perfect, he says, for use outside factories or football games. Arizona State University is targeting underserved communities with the same kind of test.
You're going to open this vial, stick your straw in, and fill it up to the minimum line with saliva.
University of California, Berkeley is researching something similar.
One of the great things about saliva is it's pretty easy to collect. We don't need to have personnel in full personal protective equipment doing the collection.
CU Boulder says its test is slightly less sensitive, more likely to produce false negatives than clinical lab tests, but claims its 45-minute turnaround for results more than makes up for that. It's awaiting U.S. Food and Drug Administration approval, planning to begin commercial production and testing students now, hoping
to continue to test them at certain rates during the semester to hopefully identify some asymptomatic people before they spread the disease and thereby limit the spread.
Parker believes cheap, rapid tests are the future during this pandemic.
We're going to see these coming and we're going to see them scaled up.
That, he argues, could make a big difference as we try to track and contain this very difficult disease. HENDRIK, SYBRANDY, CGTN, Denver.